Patients who generally come to see me are usually bothered by certain elements of their face that have maybe aged with time. So they may have lost some volume, they may have some lines and wrinkles, they might have some pigmentation or acne. So it's generally skin related problems, generally due to aging. Botox is safe if it's done by the qualified practitioner who knows their facial anatomy, so it's injected at the right place in the right doses. It's not safe if there's excess injected in the wrong area. So it's as it would be with alcohol. If you have too much of it, it's going to be poisonous. The same with the toxin. Fillers and Botox are very different things. Botox, what that does is it's a muscle relaxant, reduces lines and wrinkles by relaxing the muscles. Whereas fillers are usually based on a hyaluronic acid, but they can be made of other materials. Most commonly the hyaluronic acid then is used to fill in and volumize areas where with age you may have lost volume in your face or your lips, or if it's not just for those who have lost volume, but also if you want to augment it and make it enhance the features that you've got. Peels we would use in patients that may just want a small kind of like a dose just to rejuvenate their skin, just give them a nice little glow. Or it may be that they've got pigmentation issues and they want to address the pigmentation on their skin. You can also use peels if you've got acne, especially people who are quite resistant to medical treatment. They may well want to use a peel to see if they can address it from that angle. I would say what they need to consider is, are they doing it for themselves or are they doing it for someone else? Because actually, if you're doing it for someone else, you're never really going to be happy with the results. You're relying on someone else's opinion of it. These treatments are for you, and you're the only person that can decide whether you want them done. We can put in just a tiny little bit of filler or do a little bit of needling or a little bit of peel and make a massive difference to someone, because what they feel is at least they've done something about it, and that little bit can be enough to make them feel like they're on top of the world. Other people might need a lot more. So it really depends on what the confidence levels are like and how people see themselves before they come into the surgery. The results will depend upon that rather than how much we put in. Because although we might assess the skin and say, oh, there's been a massive amount of aging and you need this much filler, when we put a little bit of filler in, they might feel that's absolutely what they wanted. They don't want to look plastic. We're not aiming to make you plastic. We're aiming to give you subtle changes where your friends look at you and they're giving you compliments and saying, you look really great. They can't say what the difference is, and that's the whole key to it.